Explainer. Today, we're diving into a crazy medical mystery. What happens when your body sabotages itself? Imagine waking up totally covered in bruises. For folks with a rare blood disorder called ITP, that's reality. Let's break down that giant name. Immune just means your own immune system gets confused and attacks you. Next up, thrombocytopenic. Basically, your platelets, those tiny cellular sandbags that stop you from bleeding, are severely depleted. And finally, purpura. That's the spontaneous bruising and tiny red spots you actually see on the skin. To give you some context, a healthy person has at least 150,000 platelets per microliter. But in ITP, that count absolutely plummets below 20,000. That's a massive risk for severe internal bleeding. The demographic split is wild. Kids usually bounce back fast after a virus, but adults, it's a chronic battle. So how do doctors figure it out? It's a diagnosis of exclusion, a real clinical detective story. They literally have to rule out the usual suspects first, stuff like HIV, hepatitis C, and systemic lupus. It takes thorough patient history, physical exams, and complete blood counts just to spot those isolated low platelets. Once those are cleared, the true culprit appears. Rogue autoantibodies, basically tagging perfectly healthy platelets for destruction. Those tagged platelets travel to the spleen. There, aggressive cells called macrophages ruthlessly eat them up. So, with the spleen nailed as the active crime scene, the big question is, how do we fix it? Well, medical guidelines are constantly updating worldwide to help doctors manage this incredibly complex disease. Looking here, you can see how treatments escalate. They build from quick first-line fixes to major interventions. First up are corticosteroids. They act like a heavy blanket, temporarily suppressing that overactive immune system. In a crisis, IVIG acts as a super clever decoy. It totally distracts those macrophages from eating platelets. Now, TPO agonists are awesome. They literally force your bone marrow into overdrive to pump out new platelets. If absolutely nothing else works, surgery is the last resort. A splenectomy entirely removes that primary destruction zone. Get this, sometimes just curing a hidden H. pylori stomach bug completely fixes an adult's platelet count. Crazy, right? Ultimately, a lot of adults just find a new normal, living safely and comfortably with fewer platelets. Which leaves us with this thought. If our immune system